healthcare, rather than what I believe, which is profit and competition, would solve the problem if they let profit and competition work without regulation. If there is a public option, which, and I might as well take a side point here. I've heard this said that there's 5 bills. There are not 5 bills. There's 1 bill. It's a bill, this bill, introduced by Waxman, Rangel, and Miller. And that 3 different versions came out of committee because each committee did a few different amendments, but there's 1 bill. There is no bill in the Senate. This is a bill that all the committees agreed to, along with the administration. And that in the Senate, they have a disagreement between the main bill that looks like this and Senator Baucus in Finance, but he doesn't actually have a bill. He has half of a bill. That's where they were. This is the only bill that exists. And that it looks like, rather than the Waxman bill that came out of Energy and Commerce, remember, Henry Waxman opposed Nancy Pelosi for Speaker. George Miller was her campaign manager. And that Miller has said that it'll be the ed and labor version that we did that is more likely to be the fundamental bill. Now, in that core issue, they have to have a public option, and they say, in response to the business question that I had up there, that the fee would be 8% of payroll on a business. Now, I have not found any businessman, when I tell them this, that will not take the 8% option. Because at the Goshen Chamber meeting, he came back and he said, this one man said, well, our health insurance costs us 16%. Of course I would take the 8% option. He then surveyed here in Elkhart County, found that in the manufacturing firms, the average cost of their health care was 19.9%, and the nonprofit sector was 22.1% over payroll. If a business is offered 8%, of course they're going to take it. Well, why? The government, for example, doesn't count buildings. We've been through this with student loans. They don't have a depreciation amortization. So what they're comparing is no fixed cost. Then they take out the lighting. That's a different budget. The payroll, the top people and execs, that's a different budget. They have no mixed cost. And they don't even know what I'm talking about when I say they don't count fixed, mixed, and variable costs, because they haven't run a business. So that in the challenge here is you have an 8% government-funded or quasi-government entity that's getting funded that's mandating the same conditions that are costing 16% in the private sector. Furthermore, one of the first amendments was from Yvette Clark of New York, and her amendment said, well, baby care should be covered. Now, we had offered an amendment that says catastrophic, get your own HSA, and be able to decide what you want. If you're a senior, well, baby care isn't the biggest thing. That in the mix here, that they want to cover well baby care. We said, you're already adding to the list of the mandates, and we're barely 2 hours into our markup. And they said, you're against well baby care? Don't you realize? Now, when we stars come in, we have people come in with terrible, sad cases about their individual kids, and the next thing you know, we're mandating that insurance has to carry this case. You do not want medical decisions made by the United States Congress. If you're a businessman, we still have, my sisters and I own the buildings at this point in the little town of Grable that my dad sent me to business school and to graduate business school at Notre Dame. And in the mix here, what you cannot handle in a business is uncertainty. In the government situation here is they are giving every business guaranteed monthly insecurity that the private sector is going to raise the rates versus a fixed government option that's subsidized. That's why we believe as long as a public option or a fake public option, meaning a Sallie Mae, Fannie Mae, is there, it will drive out, the only question is 3 years, 5 years, 10 years, or 20 years, depending on how they do this, it will drive out the private option and lead to a federal takeover. In Elkhart County, and there was a quote from me because, as many of you know, I carried the Religious Freedom in the Workplace, the Amish bill that dealt with being able to have younger kids be able to work in a building as long as they didn't work on the saw. And I have, because I actually was in a New York Times puzzle, who in Congress, I think I'm the only one who ever had a family who's Amish, and my great-grandpa was one of the first Amish settlers in Allen County in 1846. I believe in strong religious freedom, and I believe that you need to have minimum oversight when possible of the Amish community if they're going to exist, because they don't use the same equipment, they don't have other ways to be as efficient, so you have to give them some flexibility. But in society, we've said, for example, if you're doing grade A milk, then you do have to have electric cooler. We said if you're putting something into a stream that goes to other people, there are lines here. And most of the Amish objections to this bill are the same as any other religious objections to the bill. Many denominations do not want to pay for abortions. They have concerns about different mandates. But if you go to a public hospital or anywhere touch the public health system, it isn't just the Amish here. It's every religion in America. This 8% covers part-time as well. It will cover church camps. It will cover Christian daycare. It will cover missionaries. This is in this question about employer mandates is basically that. An employer includes non-governmental institutions. This is an 8% tax on churches. We have not had anything like this before. And one of the things that we're coming back to, because Association of Christian Schools and others, one of the constitutional challenges here is where does religious liberty meet the goal of, in effect, universal health care? And these are tough questions and tough constitutional questions. And it has not really been debated yet, and I'm not sure how it's going to resolve. They're saying they're going to exempt some religious institutions, but it's not clear how you do that in the confines of how they want to define the bill. Okay,